Good afternoon to everyone. Good afternoon to all the followers and the viewers. Thank you so much. I would like to take these opportunities to say thank you for supporting our live program every week. Okay, thank you for following us in Instagram, Facebook, and then to our YouTube also. For those, don't forget to like our Facebook page. Just go to the Charles Lee Aesthetic Surgery and then turn on the notification so you won't miss anything our new update every day, like a promotion and then live. And then for those who following us at the Facebook and then not yet follow us in the Instagram, you can just go to our Instagram. Just go to Dr. Charles Lee Sabah and then follow us, and then go search view our video and post there. It's very nice for you to see. And then don't forget to subscribe our YouTube channel, which is Plastic Surgeon Dr. Charles Lee, and don't forget to press the bell button for you to get an alert when we live. Okay. So today my name is Tiara, and I would like to acknowledge my colleague here. He will not appear in this screen, but she is the one that will control everything here. Thank you for Mary because of the effort. Thank you so much. And then now today we are going to talk about our topic. Our topic today is about skin pigmentation and melasma. Wow, it's so interesting, right? Everyone, we still a human. We always get the problem like skin pigmentation and then the melasma also. So that's why today I'm going to invite Dr. Charles Lee to talk more about the skin pigmentation and the melasma, so you guys can get more information about why the skin pigmentation come like that. So okay, now I would like to invite Dr. Charles Lee.
Okay, let me have my chair. Okay, hi everyone. Welcome to another session of SkinMatrix Academy. That was Tiara. And again, Tiara mentioned that the girl who's putting all this together, the producer of these live shows, is Mary, and Mary is right at the back. So if you come and visit us at Glen Eagles, you'll be able to meet both Tiara and Mary. So once again, congratulations for joining us. Now listen, two things are happening right now. We are live on Facebook. So on Facebook, the page is Charles Lee Aesthetic Surgery. We're also live on Instagram, which is Dr. Charles Lee Sabah. So I want to congratulate all of you for joining us. You know, this is lunchtime on a Friday. And why are you spending some time with this plastic surgeon and these two beautiful girls? But it's because every invitation has consequences. I believe that for many, many years. Invitations can change your life. How you respond to an invitation can change the course of your life. So you will find me focusing from Facebook to Instagram. Those of you who are actually on Instagram and Facebook, you can get onto YouTube, because YouTube is excellent. You know, just type in there, go to YouTube and type in there Plastic Surgeon Dr. Charles Lee, and we are live. And so the purpose of these lunchtime sessions or lunchtime talks on SkinMatrix Academy is for me to just have your company. I love your company. And it's not often that you'll be able to get a chance to have a chat with a plastic surgeon. So right now, all you girls, I want to welcome all of you, Christy, O.C. Roberts, all of you all who are coming in. Thank you very much. Congratulations for making this time with me and with the girls. Send in your questions because, listen, 3 words. Keep it simple. If there's anything that you can learn or take home for this luncheon talk, it's these 3 words. I love you, of course, and keep it simple. Because this problem is called skin pigmentation and melasma. These are the most commonest problems that I see in my practice, even as a plastic surgeon. So you're going to get a plastic surgeon's perspective on this very common problem that is so agonizing. And I'm not a skin specialist, I'm not a dermatologist, but I'm a board certified plastic surgeon. And when I first came to Sabah way back in 1987, I used to do visiting clinics. Then in 1989, I started the first department of plastic surgery. And by the way, my name is Charles Lee. So if you expected a Chinese, I'm sorry to disappoint you. But I was born a Chinese, but because of skin pigmentation and melasma, but anyway, that's by the by. I'm a Ceylonese, but somehow or other, I was baptized. My great-great-grandfathers were all from Sri Lanka. And, as Christians, we were baptized with the name Edwin Foster W. Lee, which was a bishop. And he gave the name Lee. And so as Christians, the name Lee has gone down over the years, and I've been an innocent victim to that. So I've got no Chinese blood, okay, thank God. And it's just that the Lee can sometimes be, a misnomer. So when they come in here and they look for a Chinese plastic surgeon, and if you are busy, I would say, baru sudah keluar, and they will wait for the Chinese doctor to come, and finally they will realize that it's me. So there you go. So that's the story, because many of you have been asking me, I thought you were Chinese. Adopted. And I said, no. Pure Ceylonese, in everything that I do, think, and say. So anyway, that is just the storyline. So I came in here in 1989, started the first department of plastic surgery in Queen Elizabeth Hospital in Kota Kinabalu. And in the course of the last 35 years, as a plastic surgeon, most of our practice, 98% of my work personally is on the face and the neck. And in the course of treating patients because of aging problems or because of skin cancer or because of some form of reconstructive surgery, skin pigmentation has always been a problem. And I want to just tell you that, as long as you can keep it simple, you're fine, because they've got some excellent dermatologists right here in Kota Kinabalu. And how do you then move on through the aging process? And so it's like a piece of material that has got a stain on it. All right. So the skin is an envelope. It's the largest envelope in the body, right? It's a skin. And so when there's a stain, you will try all sorts of detergents and all that to get that stain removed. So when I'm working on the face, whether it's for skin tightening or for lifting or whatever, it's a nightmare when you have a small patch of pigmentation, and it's such a distressing thought to the patient. And so because of that, and because of the science over the last 30 years, we've been able to try and control it. There is no cure for skin pigmentation, or for that matter, melasma. Throw out the word cure. But certainly as in the problem of melasma, which I will talk about, you can certainly dampen it down. You can quieten it down. Because of the problem of these two conditions. So what I want to try and tell you right now today is that skin pigmentation, you were not born with pigment unless it's a congenital nevus. But pigmentation is photo-aging disease, as far as I'm concerned. So like any disease, you don't look at it. I get patients who come in here and, they're already about an age and they've accepted it. And it's okay lah, doctor, this one already old already ma. They accept the problem when actually it's a disease. And sometimes it reflects on some of the problems that are going on interiorly, okay? So it's a very difficult problem. And because it's difficult, there's so many types of treatments. And I believe that what I want to try and share with you today is just some of the the thoughts that have gone through my mind over the last 35 years and how to stay safe. And so we start off with the word pigmentation. And the most commonest pigmentation that I see in my practice when they come to me on account of aging and wrinkles and problems of just the aging process is what is called PIH, which is post-inflammatory hyperpigmentation. Hyper means more pigmentation, all right? And so the word in between post-inflammatory hyperpigmentation, or PIH, is the word inflammation. So inflammation, the root word of that is flames. Flames means fire. So there's something that is burning, something that is causing the flames, that is causing this problem where the cells called the melanocytes, okay? So these melanocytes produce pigment, all right? And that pigment is called melanin. And the cells that come through out of it, and they are all in what is called organelles called melanosomes, all right? So all of us have the same amount and the quantity of melanocytes, but it is the melanosomes, these are the ones that carry the pigment of varying sizes. They shift in size. So those who are darker skinned like myself, when you're talking about a phenotype or a Fitzpatrick type 4, 5, 6, those melanosomes are much bigger, and that's why they vary in pigment. So you got to understand that PIH, the commonest PIH problem I face, post-inflammatory hyperpigmentation. That means after the inflammation has gone on and then it's now beginning to subside, there are trademarks of it. And that trademark is actually the problem that we face. It can take months. A simple acne. So I see it in healing acne scars. Acne that is healing acne. When the inflammation is kind of like burnt itself out and then is beginning to resolve. Those are the difficult problems that I see in my practice because they end up with scars. And so if you're not wise, you see, keep it simple. You will start going out for treatment that can cause further damage. All right, so that's the most commonest that I see in my practice, post-inflammatory hyperpigmentation. And so when they come and see me, they end up with dark spots, and it interferes with their look. And two things that you need to really understand: don't make it worse. All right, find out the cause of it. And once you know the cause of that PIH, there are many causes. But today I just want to spend this lunch with you to highlight to you that if you look at the person next to you, or if you've got a mirror, look at yourself. Remember, if there is pigmentation or there's a spot that's troubling you, think of it as a disease. It is photo-aging disease, something that is happening on the outside that's causing the problem on the inside. Whereas in the case of PIH, it's different because it's very localized, you see. And as I said just now, the commonest cause is acne. And if you look at, if you look at this model, you will find that the sebaceous glands are just alongside the hair follicle. Let me turn it round. And you can see that the sebaceous gland, these are the sebaceous glands. Can you see? On Facebook, can you see? These are the sebaceous glands. And so when they get, kind of like inflamed and there's a lot of sebum, and this is called a pilosebaceous unit. So it's together. And so you can understand why the scars are so deep. So that's why when we get inflammation or post-inflammatory hyperpigmentation, it involves both the epidermis and the dermis, and both layers. Sometimes they're quite superficial, sometimes they're quite deep. But remember how deep it is. And so this hyperpigmentation involves both layers of the skin. And I think many of you all know that the skin has got two layers, epidermis and dermis. And so when it involves both the layers, the thinking process of how you treat it can be damaging if you just think it's quite superficial. So PIH, if it's treated well, arrested early, you can really resolve it. It can really heal well. I'll give you an example. For example, here's a patient of mine. I don't know whether you can see. And she came in with really troubled skin. Can you see? Acne, she broke out into breakouts and all that. And, it was horrendous. And she went through treatment with me for 3 months. And we were able to calm it all down. And I'll tell you what the treatments we did later. But she was able to have some beautiful skin at the end of it, see? Hardly any stains, a few marks here and there. but we were able to resolve this acne troubled hyperpigmentation or PIH. So it's treatable, but you got to know the cause and you got to catch it early. And so in the kind of treatments that I do, the main thing is that do not cause more trouble. And sometimes if they're really bad, I refer them to a dermatologist because they'll give you some beautiful results. But at the same time, remember it's a photoaging disease. So I want to just tell you that the commonest cause of skin pigmentation is because of sun exposure, okay? Sunlight. You can't run away from it. It is always there. And this is why, if you're having a PIH, you got to be able to use the right treatment protocol to be able to prevent it from getting worse, because sometimes you can get a stain from an acne scar that can stay there for months. And if you don't watch out, and I see ladies who come and see me, they've got this acne problem or healing acne, and they'll put this cream and that cream and they'll try everything because it's so distressing, especially if you are, a young girl going out. And what makes it worse is one word: skin irritation. Remember, anything that you put on your skin, if it starts to irritate it, it makes the pigmentation worse. So when they come in here for treatment, especially for wrinkles or they've got some hydrofacial treatment, my goodness, it takes about 6 to 8 minutes to remove the foundation because they've covered up all the pigment spots with layers and layers and layers of cosmetic foundation upon it, thick foundation, block the whole thing, makes it worse. So 2 words I want to keep you writing it down. If you're doing lunchtime, take the paper towel or whatever serviette you've got, or just write it down there, tissue, write it there. Sun exposure and skin irritation, 2 things that you got to watch out for. So I want to just move on. That this is a localized problem. PIH is localized. It's on an area that had an inflammation. And the key is that because it is inflammatory process, much of the treatment that I do, at least in my practice, is anti-inflammation. You want to cut that inflammation down. You want to dampen everything so that the process can heal by itself. Now, I know that a lot of the triggers that we do, when we talk about this, when we talk about sunlight, for example, the most important skincare that you should have on your table right now is a sunscreen. Because if you do not have sunscreen, it is the most important part of your skincare regime. All right, and so much of the damage that I see is because they don't choose the right sunscreens. So one of the questions that I have down here is that how to choose the right sunscreen. We've had so many Q&As, they're all over the place, and I thank you for sending in your Q&As. And once again, if you have just joined me on Instagram, thank you. Once again on Facebook, Charles Lee Aesthetic Surgery. Please remember what Tiara said, notifications, go press it so that you can follow us. And again, we are on YouTube. And YouTube is Plastic Surgeon Dr. Charles Lee. So the question here was how to choose the right sunscreen. So I'm talking about skin pigmentation today. And later on, I will just move into a little bit of melasma. And how to choose a sunscreen. But both of them, even though they are both pigmentation, PIH and melasma are both pigmentary problems, but they are different in their treatment. So be careful. Don't go and walk into a mall and then go to a counter and just pick up whatever you like, thinking that they're both the same. They are not the same. The problems are different. And so your approach to melasma and PIH or post-inflammatory are different, okay? So I'm just sharing with you what I commonly see in my practice, especially sometimes if I've done a scar or facelift, or we've removed some growth or something, how the scar behaves can become a little bit darkened because we are darkened skinned people. So we are prone to hyperpigmentation in the scars. And so we have a way of dealing with it. But if you don't be careful, I see people who have had some kind of scars before and they've gone and done laser work. And if you come to my practice, the 2 things that I don't have is one is a laser and one is a filler. All right, so and chemical peel would probably be the 3rd one. So I stay away from lasers because my whole practice and my thinking of when it comes to SkinMatrix is to build it. When you build it, it will grow. But when you start taking off cells, it will start to thin down. And the other thing that I want to tell you is that a lot of the problems that I see in skin pigmentation, especially if they are post-inflammatory hyperpigmentation, the skin's dried up, right? The matrix has dried up because, can you imagine with a fire, all right? You put the fire and then when you finish it, you see all the black stuff, all the charcoal that's left behind. And so the water just dries up. Now you don't take a dried up post-inflammatory skin and go and start doing laser on it and start doing treatment to hurt it more when there's nothing when it's dry on the inside. So I've found in my practice that the more and more I feed the matrix, all right, especially with water, hydration, it lightens down the pigment. All right, it's just like you go out into the sun and you've gone for, let's say, horse riding. I had a patient who came in yesterday and she loves horses. But when she comes back, she's all dried out because of the heat of the sun, right? That's the time when you really need a powerful moisturizer. So keep the water content, because have a look at this. All right, this is a cross section. Look at that. The top layer is the epidermis, which is like a bed sheet. And look at the thickness of the mattress, which is the major component of what we call together skin. So if you don't look after your mattress, which is the matrix, you're going to get all dried up. So imagine if you're dried up and you've gone right down to that level of thickness of the matrix, and then you start lasering the top and you start doing all sorts of damage to the epidermis, you're going to dry up and cause more irritation and more pigmentation. So sometimes you need wisdom here. Keep it simple. Find out what is the cause. Feed it first with the moisturizers. Keep it nice and moist. The pigment will take care of itself if you've got the right treatment for it. So PIH is a different ball game. It requires a lot of care, and because especially for acne scars, I find that if you don't watch out, because it deals with both layers of the skin, because the hair follicle is so deep. And the sebaceous gland, which is called the pilosebaceous unit, the whole process of inflammation takes time to resolve. And that's why PIH or pigmentation in a healing acne scar or area is very localized. But when I talk about melasma, it's all spread out. It's like a blotch. It's like you take a piece of paint and throw it on the wall and you get a splash. The borders are so cut out, and it's a big nightmare. So I've talked about sun exposure, which can give rise to pigmentation. And I'm not talking about the internal problems that sometimes you can have, which is hormonal, especially post-pregnancy. When they come in here, the stretch marks are all linear nigra, they're all pigmented, and the treatment for that is quite difficult. We do a lot of microneedling. So there are some questions that people have asked that you have sent in about microneedling and pigmentation, and I'll come to that a bit later. So girls, remind me about microneedling later. Now, it's about halfway through the program, and I just want to move quickly to melasma. Now, it's interesting that when I see patients with melasma, sometimes it can be camouflaged with other pigmentary problems, okay? And so someone comes to me and they want to get a bit of a tightening, a skin tightening, but they've got melasma. Melasma is actually hyperpigmentation of the skin. It's a disease, actually. It's like tattooing on a skin, and sometimes it usually involves both layers, and it can be quite deep intradermally. So the treatment is difficult. I mean, at least in my hands, it's a challenge. But if you are very careful, you can actually control it or dampen it, and tone it down. It's difficult to. There's no cure that I know of that can take away your melasma problems, but you can certainly damp it down. And so in my hands, basically it's a disease of hyperpigmentation, and the two major causes of it is sun exposure and heat exposure. Okay, and I'll come to this a bit later. So you can get it on the cheeks. I see them usually difficultly over the upper lip. It looks like a mustache, and it's quite embarrassing for women who come in here for skin tightening and all that, and they've got this staining that's going on the upper lip. Sometimes you can go right across the nose forehead, and even the neck, So melasma is a tough problem to treat, but yet we do treat them, because it's no point me doing a nice procedure and then trying to find out how the heck to remove this stain. And because the patient can be really happy with the result, but they keep looking at the stain and they can't understand that that's the first thing they see. So in my practice of melasma, there are many causes to it, but there are triggers, and the biggest trigger of all, of course, is sun exposure. And so therefore you have to be very careful about sun, protecting yourself, and this is key. Sunscreen is key. All right. So for example, I get ladies who when they go and blow dry their hair, I always tell them, keep the blow dryer away from your face, because these are things that can happen when you're going out on the outside. So let's talk about sun exposure, and let's talk about sunscreen for the moment. How to choose the right sunscreen, which is one of the questions. Now, for me, I think in my practice, we have what's called mineral sunscreens, because the filters, they are mineral filters. I like them because they are ideal for patients who've got melasma. And it's important to know what type of sunscreen you're using. So the SPF, which is the sun protective factor, that's the meaning of SPF. Usually I give them about 50, and it contains this mineral filter, which is zinc oxide and titanium oxide. These are pretty good for patients who are having PIH, or their patients, especially with melasma. And I like the tinted ones. If you're looking for a sunscreen, go for a tinted one, because the tinted sunscreens have got what I call iron oxides. And these are pretty good for patients who have got melasma. So a tinted mineral sunscreen with filters of zinc oxide or titanium oxide will do pretty good, pretty cool for you. I use dermaceutics in my clinic. And so those of you who are looking for a good sunscreen, if you've got pigment problems or melasma problems, I would recommend that you go for a tinted sunscreen with the mineral filters of zinc oxide. I use zinc a lot in my practice. Even the cleanser that we use in the practice is zinc. It's a foam cleanser, but it's got zinc in it. When I deal with patients who have got burns, we give them orally zinc. So it's a very important element that's for the skin. So that's something about the sunscreen. And so if you're going out and you've got melasma and you're a sun-loving person, protect yourself. Wear a hat. Just make sure that you're tinted well. When you're driving, for example, make sure that I got ladies who come and see me, and they somehow or other they've aged on one side, of the face, and the melasma seems to be more on the right side as opposed. So it's uneven skin tone. And the reason is because they're driving all the time. They take their children to school, they picked up the children during lunchtime. And so the radiation of the UV radiation through the windscreen, through the window pane, affects that particular part of the face. So I'm moving on to the next thing. So when you're talking about sunlight exposure, it's usually the UV radiation when it comes to melasma. And I'm a big believer, that the UVB causes sunburn, but it's a UVA, and that UVA 1 and 2. If you have a tinted oxide, iron oxide and zinc oxide and titanium oxide, it helps to knock off the UVA 1 and 2. UVA 1 and 2. So that's why I like the iron oxides, they're tinted. They're pretty cool for those patients who have got melasma, okay? So once again, I was talking about, let me see if I can just I'm still live, right? And so that's important in the choice of your UV, okay? And don't forget, whenever we talk about UV radiation, for those with melasma, we also have a problem with visible light. Don't forget that, all right? So visible light, especially the blue light. I have a red light and blue light here in my practice. So before I put the patient on red lights and blue lights, I always check out to make sure that they don't have any underlying, quiet melasma process going on, because UV, especially the blue light, can cause and irritate the skin, and you get a worse condition out of melasma. So this is very important for you to know, that blue light is not really recommended if you've got a melasmic problem. But when it comes to skin pigmentation also, I'm quite careful when I use light. So don't, keep away from saunas and keep anything that, so the next cause of, of irritation in melasmic patients is heat exposure, as I was saying. So anything to do with heat, can aggravate your melasma. I find that those who are working in the kitchen, for example, cooks. There's a cook I know in Fosang, and horrible melasma because of the heat that comes from the quali, and sometimes it happens to male patients too. I know a lady down here in Riverson who does goreng pisang, the oil, and the heat from the oil just keeps on getting onto her face, and she has got this melasma problems with it being aggravated. So I told her to go and get what is called a cool kind of like a curtain. It's a kind of a fold that you hang it around your ear, and it's got a drape which is white in color. Don't go for the black ones, because the black ones will absorb heat. But it's a white color kind of a cloth that's called special. It's very cooling material, like Naful type, and it just falls down like a curtain over her face, and that helps to protect the heat. And sometimes while she's doing the goreng pisang, I tell her to put some ice cubes below the tongue, and that kind of like cools down the whole process of heat exposure when it comes to melasma. So the question that was asked, is PIH and melasma the same? It's not. Both of them are pigment problems, but both of them go through a different journey, and so you need to be careful. For example, in my practice, I have what's called thermage. And thermage is radio frequency to lift, to tighten up the face and skin. And this is something that is a gold standard. And nobody has it here in Sabah, Sarawak, and Brunei. But thermage, it creates heat. And that heat is produced by radio frequency. So by heating up the skin, it stimulates the fibroblast, and that denatures the protein and causes collagenesis, new collagenesis, and collagen starts to form. But it needs a heating process. So patients who are coming for, for tightening of the skin, I get them to get ice cubes, to suck the ice cubes. I don't like putting anything cold on the skin for patients with melasma, like damp cloth or damp sponges or whatever. No, which are cold. No, it's probably better to put it in the mouth underneath the tongue. Sometimes if I'm working on the right side of the cheek and I'm lifting and I'm causing heat, then I get them to suck an ice cube on the inside of the cheek. And the purpose of this is the third cause of in melasma is the vascular component. You will find that under the skin, you've got all these blood vessels. You understand? And these blood vessels are in the different layers of the dermis. If for example, if I were to show you this, and you can see that there's a blood vessel in this layer, and then there are blood vessels in this layer. So these are called the dermal plexus that feed the dermis. And so whenever there's heat and when the vessels start to dilate, it aggravates. The melanocyte starts to produce more melanin, which is the pigment. And that's why to quieten it down, you see, there's so much of heat being generated that I find that if you put ice cubes into your mouth, into your, or underneath your tongue, just suck it. It tends to cool down the body temperature and keeps the vessels less dilated. So this is something that you can bear in mind. If you've got melasma problems or you've got bad pigment problems and you're going to get your hair done, or just get some cubes in and put it in, just cool it all down. So that's a trick that I find, but not putting damp or not putting cold stuff on the skin, but you can work from inside your mouth. So I hope that's a tip that I find that those who are going in for treatment. And so the idea is that you don't want to create any more injury. All right, so that's why I don't do lasers. I find that these are problems. The only laser that can help out, especially patients with melasma, because of the vascular tone that is underneath, is what is called yellow light. Okay, so Quantum Pro is a pretty good laser. It's a yellow light laser, and this is specific because it tends to dampen down the vascular component of melasma. Because they have found out now that the vessels underneath close to the melanocytes that produce these melanosomes that contain the melanin pigment, the vessels are dilated. So if we can cut down the vessels that are dilated, it helps in the pigmentation, especially in melasma. So these are some of the points that I thought I'll just discuss during lunchtime. Pigmentation is a big problem. So remember that choose the right sunscreen. I've told you that the sunscreen that I normally recommend is the one with got zinc oxide and it's got a bit of titanium oxide. If you've got melasma, then go for tinted. Because the tint that has got iron oxides is pretty cool, especially for UVA 1 and 2. And if you're doing anything that's heating, if you're going to go into the kitchen and you're going to have to cook and you've got this melasma problem, put in some cubes, suck in some, just keep your body temperature cool, all right? Don't go for saunas, and remember steam baths, and especially if you're doing facial and then you got this steam blowing on your face, it's going to aggravate whatever pigmentation you have. I found that out in some of my patients, when they come in and I say, why is your spots have gone so dark? Oh, I just did a steam facial. Oh my God. There's already fire there. You want to go and put more fire there and then cook satay, So, and it's very interesting now that I mentioned satay. If you go to Fosang and there's a place there called Lotus, and there's a lady there, poor thing, and she's doing satay, girls, satay. Next time you go and buy satay, you go and see the lady and check out for pigmentation. Seriously. And there's so much of heat in the sun, and she's fanning the coal, And then I told her, look, you got melasma, butulka, apa itu, ah? And and then so now she's wearing a kind of a white curtain. I told you it goes around the ear. You can get it on the internet, and she's got a white kind of thing. It's very cool, beautiful material, but actually it protects the heat. So if you're driving, tinted, glass, all that sort of thing is important, so that you don't have this problem. Okay, so I hope that I've covered some aspect. Now, in my practice, when I'm dealing with pigmentation, when I'm dealing with anybody that's coming for any facial treatment, the key vitamin, people ask me, doctor, do you do vitamin C IV drip to make your skin whiter? I said, if vitamin C works, I also want. I also want to get fairer, man. So, there is no proof medically that intravenous vitamin C gives you whitening. Nothing, nada, not in my practice. So if you're going to get vitamin C drips, by all means, go ahead, go outside and do it. But there is no medical proof. But what is important is that there's only one vitamin that goes into the cell. If you can tell me the name of that vitamin, you have a free gift, because we got a lot of free gifts today. And I want to, so that's the first question. Write down the questions I'm asking. What is the most important vitamin for your skincare? Question number 1. Question number 2. What are the 2 important exposures that will aggravate melasma? All right, give me 2. Don't give me 1. I want 2. I mentioned 2 already. So if you mentioned, so that's the second question. Okay, pardon? So those are the 2 questions. The first question is, what is I forgot the first question, man. What's the first? Which is the most important vitamin that is for your skin, okay, or skin cells, or for that matter, any cell in the body. Which is the vitamin that's most important, okay, and that can enter the cell? Big difference, huh? It's just like PIH and melasma. They're, even though they're both pigment problems, but they're different. Second question was, what's the second question again? And the second question was, what are the 2 exposures that are very important and trigger melasma? Okay, and I'll give you 2 minutes, and if you can answer that, be excellent. So there you go. So I'm talking about that. So anyway, now that there's no reply, right? No reply. So the most important vitamin in my practice that I give intravenously is vitamin A. Vitamin A, all right, is the only vitamin that controls the DNA of the cell. So I find that in all my treatments that I do, there is a vitamin A infusion that is going on, because it not only helps in the immunity, but it also helps in the integrity and the health of the cell. You see, the powerhouse of every cell is what is called a mitochondria. And that mitochondria is like the ATM machine. When you go to an ATM machine, what do you get out of the ATM machine? Money, right? Sometimes I go to the ATM machine, there's no money. Same with the mitochondria. The purpose of the mitochondria is a powerhouse, and it generates ATP, which is the energy. So in all my treatment that I do, I want an active, even though the patient is 55 years old, I want a young, really pumped up mitochondria that's putting out what it has supposed to do. And the cell that lays collagen is called the fibroblast. So for me, I want the mitochondria in the fibroblast doing the work of a 40-year-old instead of a 60-year-old. And that's why in my practice, when I'm dealing with pigmentary problems, they're coming in for facelifts or they're coming in for some non-invasive surgical treatment, the key is vitamin A infusion, because vitamin A is excellent for the integrity of the cell. It's important for DNA. It helps in the synthesis of collagen, and it is the only vitamin that enters into the cell. So when you talk about UVA and UV radiation, the A is the one that is absorbed by the vitamin A. And if we don't have enough of vitamin A, that's when everything breaks down. Remember, vitamin C is an antioxidant. You don't go and take vitamin C for your lightening of the skin. Yeah, it does help. One of the side effects of vitamin C is that it also inhibits the production of melanin, which is a pigment. But by itself, it's one of the side effects of it. And so that's the reason why girls remind me about iontophoresis and this. And so vitamin C, vitamin E, glutathione, all these are called antioxidants. I call them the antioxidant brigade. The brigade protects what's inside the cell, which is vitamin A. So I use this preparation of vitamin A infusion. It's called retinaldehyde palmitate. And because the vitamin A preparations outside, tretinoin, whether it's retin A or retinoic acid, sometimes they're pretty harsh on the skin, they're quite sensitive. So I like the IV infusion. So if you've got melasma, if you've got PIH, when they're getting treatment here, they have a vitamin A infusion as well in the treatment. So I've talked about yellow light, I've talked about vitamin A infusion, I've talked about sunscreen and how to choose a tinted one with a mineral filter, iron oxide, zinc oxide, titanium oxide. I've talked about practically everything that I want to know. Yellow light, did I mention? Yes. And so I don't do any chemical peels in my practice, okay? I stay away from lasers. The only laser that I have in my practice is what's called a CO2 laser for age spots. But I don't like it. So remember one thing this afternoon during this lunch. Be careful. Keep it simple. If we've got pigmentation and you are my color or you're Fitzpatrick or whatever phototype you are, which you are 3 or 4 or 5 or 6, be careful. Don't go for the name. I got people who call me here, do you have a pico laser? And I say, yeah, it'll pick your laser when you come in here. I'm very aggressive because the media is so toxic. After 35 years as a plastic surgeon, the media has totally brutalized the word beauty. So be careful, be educated, ask the right questions. And what are you trying to prove, doctor, when you do this laser treatment for me? Okay, so if the natural process of shedding skin, which is called exfoliation, naturally, you will find that if there is a beautiful process to aid and take away all that dead skin, you got fresh keratinocytes coming up. That's the way to handle pigmentation, all right? Regular, we have hydrofacial here, and this is what is important for you. That as long as you're having some very good exfoliative process, be careful also what type of acid you use. I don't use chemical peels, but even though it's a very light peel, for example, glycolic or, lactic acid is excellent. I like that if it's skin irritation there. So you need to choose that, okay? So I think we've covered quite a bit. I'm going to touch on something which people ask me, of course, is skin whitening, which is the next topic for the next talk. I use a lot of glutathione in my practice. Remember, glutathione is an antioxidant, all right? It's produced in the liver. And so I apply it intradermally. So there's a lot of work that we do here where we use a special gun and we go intradermally. I find that the best treatment for all these pigment problems, including melasma, is intradermal injection of these products that kind of like, quieten down everything. They inhibit the production of melanin, especially tyrosinase, which is an enzyme in the melanin production. So it just quietens it all down. So I like glutathione in the treatment of melanin and especially also of hyperpigmentation. The other treatment that is used in my practice for melasma is what is called tranexamic acid. Okay, so TA, tranexamic acid. That also inhibits the production of melanin and is quite helpful. So I use it intradermally. So it's got to be chosen carefully. All these treatments, there's no one road and one way answer to PIH or, for example, melasma. PIH, if you treat it well, sometimes it can be totally resolved, and that's the picture I showed you. And I'm very proud of her. Her name is Carol, and every time she comes and sees me, I sing the song "Oh Carol" to her, because look at that, excellent in 3 months. All right, and the reason why this result is excellent because of the treatment that we did. It was a 5-pronged treatment. All right, so we help her in the keratinization clearance by doing hydrofacial, so it's exfoliation. We help her in the pigmentation. We don't touch her with light. And of course, the other thing that I normally do is what is called platelet-rich plasma, added on with what's called Z-lift. Now, sometimes I try and stay away from heat. So when I'm dealing with patients with, with acne, can I come in here? Here we go. So these are some of the ways that you can get treatment into the skin, intradermal transfer. That means through the epidermis. You see, my main idea is to go through the epidermis into the dermis without hurting the epidermis. That's the key when you come to the treatment of pigmentation. How do I get whatever I'm putting out there, whether it's nutraceuticals or cosmeceuticals, how do I get the good stuff into the dermis where the melanocytes are without hurting the epidermis? You know what I'm trying to say? So this is why we use, so for example, this is iontophoresis. So it's an ionic transfer. And I like this when, for example, in glutathione, we use this, or in tranexamic acid, we use this. Vitamin C, we use this. By means of ionic transfer, you go intradermally. So this is iontophoresis. The other one that we use here is what is called sonophoresis, using ultrasound. So we put in all whatever we want to do from here. For example, whether it's tranexamic acid or glutathione, and then we use ultrasound. And this process is called sonophoresis. And that particular way of sonic waves doesn't create heat, it's cold. And that is the reason why. Stay away from heat. If you've got pigment problems, especially melasma, heat is your enemy. All right, so that's why stay away from heat. So all the other processes that we can get the good stuff in, we do it here. And the treatment's only about, what, 350 ringgit to about, or more, depending upon what we put in. So we've talked about it, and again, that when I talked about glutathione, I tell you something, here's the secret. One of the best sources of glutathione is broccoli. Broccoli and asparagus. If you like broccoli, I don't like broccoli, but if you like broccoli, and if you love, I love asparagus, but these are the two pretty cool sources of glutathione. And I like glutathione. I use a lot of it in my practice. In fact, there's one of those, where is this oxythione? Take it out. So we've got tablets called oxythione, which is also glutathione, and we just put it underneath the tongue. Okay, this is called oxythione. All right, it's a supplement. It's a food supplement, so that's pretty cool. And it helps in pigmentation. You just put it underneath. Thanks, girls. Put it underneath the tongue, sublingually, and sometimes I do that twice a day. For the first month, and then after that we just maintain it daily. So glutathione is an antioxidant, but it also helps in inhibiting melanin production. Okay, there's a lot on the market, my friends. So choose carefully, keep it simple, and you'll be right on the way. So by the way, I wanted to tell you something. There's this Top Gun that is going on now. It's a movie, excellent movie. If you haven't seen it, go see it. I've seen it how many times? 3 times. Now, because of that, I'm seeing people, I don't know, not because of Top Gun, but they've been wearing these sunglasses called aviator sunglasses, which have metallic rims. Now, those metallic rims of your glasses, they start getting hot. They contain heat. And that heat can cause pigmentation around the eyes, because of the metal. So if you're using metal frames and you've got pigmentation problems and you've got melasma problems, stay away from metal frames because they take on heat. For example, like mine, I used to have a metal frame and I've got these marks here on the side of my nose. Can you see? Horrible. And that's because of heat. When you're exercising or walking and those two metal ends get heated up and then they end up with pigmentation or hyperpigmentation. So stay away from heat, and that's something that you can take home. So I think we have covered pretty all, haven't I? So again, don't forget visible light. Don't think that ultraviolet light is something that you can't see. Visible light you can see. And so even at home, I find patients who've got melasma, make sure you've got your sunscreen on. Sunscreen minimum 3 times a day, all right? Because all the sunscreens have a half-life. So minimal 3 times a day. And if you're going outdoors, if you love gardening, then be careful of what you wear. Stay away from anything that is black because it'll absorb heat. If you're cooking, remember I told you about ice cubes. If you're getting your hair done, suck your ice cubes. And if you're in love and you're burning up, suck an ice cube. and it'll be great fun. So I hope that I've been able to talk about whatever I wanted to talk about, dark spots, we are colored people. So you have to respect that whatever you do to your face, to your skin, be careful, study it, ask the right questions. What does it do? How is it going to help me? What are the side effects, I've got a question here, right, girls?
Yes.
What's the question? What's the question?
Doctor, there's one question that our followers asked before.
Yeah.
Ramai drip whitening guna transenamik. Safe kah dokter? This one is the question from our followers before.
Okay, so he's talking about whitening using tranexamic acid, IV, all right? IV, drip on a drip. I don't do that. These are all, they can have complications with them. And nobody does that. I mean, why do you want to have a whole body looking white? If it works, let me know. I'd like to do it. The only time I used TA, tranexamic acid IV, was in a bleeding ulcer during those many years ago, nearly 40 years ago, and because of a bleeding gastric ulcer. But it interferes with the clotting mechanisms and all that, so you got to be careful. So no, I don't do it. So go get somebody who does it for you, but I wouldn't advise you to do it. If I'm dealing with melasma, I would use it intradermally. Although studies have shown that oral and intradermal don't make much, but I'm quite comfortable with intradermal. Okay, so that is a question asked. Another one is, berapa sesi perlu buat? You mean to see me? How many sessions do you want to see me? Huh? What is this? Tranexamic acid. Okay, so it depends. I like that. I like to do it every 3 weeks sometimes, a minimum of 3 months, and then just watch. But there's no one answer to all the treatments of melasma or PIH. So as long as you come in here, you do your hydrofacials, you do your IV vitamin A for must, and then you do your tranexamic acid, you have your glutathione. All these just dampen down, quieten down the fire that is going on. Okay, that's the main treatment. So keep it simple, and you'll be fine. Okay, so there you go. The take-home sign, it's a photo-aging disease, and the biggest trigger is, of course, sun exposure and irritation. Anything, I do a lot of micro needling, which I wanted to mention about, and that micro needling sometimes does help. It causes micro punctures, so I choose my patients. But if they've got pigmentation, the only reason why I want to do that is sometimes I want more glutathione to go in. I want to have more tranexamic acid going. So it's just a patch that I'm working on. The rest of it is fine. So I do micro needling a lot, especially for wrinkles. But for pigmentation, I'm a bit careful because you can get PIH, you can aggravate it, you see. So, but now they've come up with creams. There are so many creams on the market. Oh my goodness. So be careful what cream you use, okay? And just stick to it. Have a plan, write it down, stick to it, and then see what the results are, because there's no one answer to it. As long as you're with a dermatologist or you come and see us, you'll be fine. You know, it's just that I'm more careful in what I do, but I'm more aggressive in what I do. So that's why I choose my patients. So that's a question there. How many sessions depends on the extent of melasma, or PIH, of course, is a bit different. But if you treat it well, you should be fine. Okay, is that all? Am I done? Okay, what are the free gifts? So if you're coming in for any treatment now, give me the free gifts here. Not free gifts, yeah. Or what are the promotions? We have a set of promotions here. Girls, you want to come in? So if you sign up, Mary, you want to come and do the promotions here? What are the promotions? And so if you sign up, for example, hydrofacial and glutathione, right? Hydrofacial, which is the glutathione and what? So, all right, so we have a promotion here. So it's about skin whitening and skin brightening. Okay, so this is, it's a combination of glutathione, together with vitamin A infusion. It's a lovely combination. So they do a hydrofacial first, get out all the keratinocytes, the dead skin, and then they come in here and they sign up for glutathione intradermally together with vitamin A infusion. Perfect for the skin cells. You get some free gifts of hair tonics here. There's a whole lot of free gifts which I don't have time to go through. But again, what is the most important vitamin that enters the cell and is important for the skin? Again, I'm giving you the last chance. What is it? Anybody got it? Yes, Stella. Okay, Stella, thank you very much for your answer. The answer is vitamin A. And what's the free gift? Okay, so Stella she's won it. It's called vitamin A. You're right. And so thank you for that, okay? And it's important for you to know that vitamin A is a very important vitamin. It's the only vitamin that gets into the cell. The rest of the vitamins are all antioxidants, okay? So that's important for you. What are the two exposures that I talked about that you have to remember when it comes to melasma? Number one, sun exposure, and the secondly is heat exposure. Yeah. So yes, Nicole on Facebook. Thank you very much for that answer. So contact 016-8245-224 and you'll get your free gift. Okay, so those are the two exposures that are important. And so if you're struggling with melasma, just remember that there are no one-way treatments, but yellow light is something that you just have to bear in mind and keep in mind with it. Okay, so are we done today? So thank you very much. Now I want to just give a shout out to next week, Wednesday. Next week Wednesday we are live again, and it's a very, very important part of my whole life, and that is network marketing. So I want you to come and join me, and you'll get to know Rachel Lee. She's an entrepreneur who loves building a whole business regarding consumers. So for me, it's a powerful opportunity for you to be able to meet with her. And the reason why she's such a successful, she earns about $60,000 a month. And the reason why I say that is because it's such an opportunity to meet somebody so successful. Okay, and the skill behind it, the mind behind it, the heart behind of what she does is so important in life, isn't it? To make life easy, to make life choices easy. So I'm a big believer in network marketing, because if you know your net worth, you will be networking. Remember that. All right. So it's all about knowing your net worth, and the biggest enemy of yourself is yourself. It's you against you. It's me against me. And so please join us next Wednesday, and we'll have a session under the Inner Club. So the Inner Club is a club that I founded called the Empowering a Network of Entrepreneurs in the Real World. And the real world is the world without disease, without inflammation. It's an anti-inflammatory epidemic that we need to start to fight this inflammation. Okay, so the Inner Club. So I welcome you to join us. Sign up, and it's great to meet entrepreneurs. My passion is to transform entrepreneurs to professionals. So network marketing is a professional, and again, right. So we've got Cindy again. Cindy, I'm not sure whether you're getting all the free gifts, man. Too many free gifts going to Cindy Tan. Cindy Tan, right? Anyway, Cindy mentions there's vitamin A. So your free gift is coming along, and we'll send it to you also. But I think the best is meet me when I'm in KL. If you're in KL, huh, Cindy, that's the best gift you can get. And I want to thank you all very much. Hi, Sante. Nice to see you. So before I end, I want to tell you a joke. Can I? Can I tell girls? Can I say again?
Yeah,
Okay,
sure,
let's end up with a happy note. It's already 2:00. You know, now this is the fun part of having a lunchtime talk. So Sante, listen to this. It's a joke, okay? So what happened was in the United Nations, they had this big General Assembly, and the Americans had just landed on the moon, and the whole world was excited, and maybe just get ready to play the slide with the music, and they landed on the moon, and the whole world was excited. So they all met in the General Assembly, all the countries, right? And they were congratulating America, and they saying, "Well done, America! You were first man landing on the moon," and all that kind of thing. And then the Minister of Foreign Affairs of India, he got up, and he said, "Very well done in America, for landing the man on the moon. But we in India have better ideas. We have better things to do." So the whole General Assembly just kept quiet, all the foreign ministers all just kept quiet. So what on earth is this, They have just landed on the moon, the Americans, we are congratulating them. But the man from India stands up and he says, "We have better things. We are much smarter than going and landing on the moon." So everybody said, "So Mr. Foreign Minister, what do you all plan to do? What do the Indians want to do?" He laughed. You know what he said? "We don't waste time going to the moon. We want to go to the sun." So all of us started laughing. "Oh my, what is this guy? Look at the amount of damage on earth we get from the sun, right? All this pigmentation I'm talking about with the sunburns and, melasma. The whole talk today was about, sun exposure, right? And this Indian foreign minister gets up and says, "We are going to the sun. America can go to the moon. India is going to the sun." So they all got up and said, "Mr. Foreign Minister, can you tell us how you Indians want to go to the sun?" And then the foreign minister said, "Ha, that's why we are in India smarter. We are going to the sun at night." We are going to the sun at night. As if at night there's no sunlight, there's no sun rays, And I tell you, the guys burst out laughing and they thought, "This is funny, man. I mean, where does the sun switch off at night? If the sun switch off at night, then we don't have to wear sunscreen at night, right?" But anyway, that's the way we end today with it's real fun talking to you. Thank you very much, guys, for joining me for lunch. Thank you, Mary. Love you, for the producer who has brought us through Facebook, Instagram, and again, we are live on YouTube. I want you to join us again next Wednesday. Again, remember, we are talking about making life's choices easy, and it'll be a great time to learn network marketing. I'm going to talk about a very, very special skincare, which I believe is the key, the missing link when it comes to skin health. You see, a lot of people are talking about skin treatment, skin care, skin health, but they are just like, surfacing, like, snorkeling. They are not going deep into the deeper end and see what is going on. So if you want to make, a skincare a business opportunity, if you want to create it that, Asia, everyone can fly. But when you do a network marketing business, everyone can have something on their table which they can afford. And that's the joy of network marketing. So I'll see you guys live next Wednesday. And so from Tiara, thank you very much. Tiara, come on and say hi. Tiara just got engaged, so that's why she's smiling. And she insisted on, starting off the afternoon session. We all have good fun. If you get to my Instagram, you will see that we are on TikTok. And TikTok is where we do most of our music and all that. So be free, please come and join us, visit us, have a look at what we're doing. Iontophoresis, sonophoresis, thermage, glutathione, tranexamic acid, you name it. As a plastic surgeon, we are here for you. So from all of us, thank you very much. Enjoy the rest of the day and stay gorgeous, because the theme, the slogan, the 3 words, right, of SkinMatrix Academy. What are those 3 words, Tiara? I love you.
You love me.
Secondly, keep
We
it
love
simple. And thirdly, which is the slogan, is you deserve better.
Better.
You deserve better. So see you all. Have a great day. And remember, there's only one way, and that is to stay gorgeous. Bye for now, from all of us.